Please proceed.
My name is Martin David Reinsel. I'm a licensed mental health counselor in the state of Washington. I'm a constituent of the 34th District as well. I work in highly acute psychiatric settings. I have over a quarter-century experience professionally and specifically over 2 decades working in highly acute crisis intervention locations, including the involuntary psychiatric hospitals in West Seattle. We see over 1,000 patients every year in this hospital. The vast majority are brought in under 71.05. With the 72-hour hold, they're a danger to self, danger to others, and we see people that are at this nexus of a very, very vulnerable and fragile point in their life, and this bill is so important with regards to public safety, obviously reducing suicidality, but also the greater good of the community. We see people coming in that have decreased insight and impaired judgment, and that does not clear up in 72 hours. And a lot of times, we see people get to go through court, and it is outside of the hospital's medical recommendations by our treatment teams to discharge someone, but the person can slip through. And if you don't mind, I'd like to cite something that just happened last week. We had somebody that was discharged from our hospital by the court against medical advice of the treatment team. And just so people understand, the treatment team is doctors, nurses, social workers, peer support counselors, et cetera, that are involved in this process. And this individual was granted release after a motion to dismiss the case was filed by the defense, since the patient had not been seen in the time frame legally allotted by the DCR. As was noted earlier, they have certain time limits, 6 hours or 12 hours. In this case, the members of the treatment team hope that this individual does not hurt someone in the community. We have no way of ensuring this, since he was released from our locked facility on a technicality. Again, this is an issue of public safety. Someone who is a risk to harming themselves or others during a time of great psychological fragility should seemingly not have access to a firearm during this time of crisis. It is that simple. Medications to stabilize take 4 to 6 weeks. We often see this go beyond hospitalization in general, even on a 14-day. So please know this period of fragility often expands long before and long after any court might decide to discharge someone. Thank you.
Thank you very much.